Look at that sun. It's ready. The sun rising. So today is a beautiful day and we're gonna be working out outside. I love when I get a chance to work out outside. And today, as we do that, I want to talk a little bit about our annual exam. When you go in to see your medical provider, your medical doctor, your nurse practitioner, or physician assistant, whoever it is you see for your care, for your regular care. When you go to see them, there is a few things I want you to have in mind, some questions you want answered before you leave, and that's what I wanted to kind of address as we work out today. Now, some of those questions, you will get an answer to them before you leave that day. Some of them will come back in form of your blood work. After you do your blood work, you come back for the result and talk to you. I want you to ask for these numbers and make sure you have them. So the day you go to see the doctor to get your annual exam done, some of the questions on that day that could be answered right away include your weight. You need to know your weight and what is normal for your height. That would be your BMI. All right. So those two things, you need to know your BMI, you need to know your weight. You need to also know your blood pressure. Very important. I don't want you to walk out of that appointment without knowing what your blood pressure reading is. Is it normal? Is it abnormal? Compare it with what they had from the last time you were there. If it's your first time, make sure you keep an eye on it. Make sure you're within the normal blood pressure range. And also, you may want to know about your heart rate. So ask them, what is my heart rate? And is that normal for me? Depending on how active you are and your history, your heart rate might be a little bit different from the other person. Do not compare with other people. Only the person taking care of you and yourself, knowing your history, will be able to tell if it is normal for you or not. So those are part of the vital signs, part of the numbers that you should ask for to make sure you have these numbers before you leave. And then the other number that you have to ask them for would be your waist circumference. Basically your pant size. So how large is your waist circumference? Why is this important? Because when the bad fat that will lay around the stomach, because the bad fat that will lay around the abdomen are the fat that kills. They are the vicious, bad, visceral fat that when we lay them, they can damage the liver. They can cause, it's actually associated to heart attacks. So you want to see what is your waist circumference. What should it be? If you are not there, you ask, what can I do to improve it? It goes back to everything that I say on here when I come on to exercise. Your food. 80% food, 20% exercise. So that's what you can do to improve that, to make it smaller, but your waist size is important for you to know. And then the day you go for your annual exam, they should end up doing blood work or write a prescription for you to come back and have them drawn. One of the very important blood work that you will need to get for your annual exam is your cholesterol panel. Yes, I said a panel because it's going to be multiple numbers that I need you to know when you get that results back and to discuss with your provider about what is normal for you, where you fit in the spectrum. So you will want to know your total cholesterol, but most importantly, you will want to know what we call your triglycerides, your LDL, which is the bad cholesterol, and the HDL, which is the good cholesterol. So these are some of the numbers that you have to know when you come back for that result. Do not let anybody just tell you, oh, your cholesterol is okay, or it's coming down. I want you to get familiar with those numbers. Only you can look out for you. Only you can, once you know those numbers, it makes a big difference as to when you are doing activities to help you bring them down, when you are eating. Remembering those numbers would hold you accountable. It is your job to know what those numbers are for you, as they are very different for everybody. You will also want to know about your diabetic or pre-diabetes or none at all state. You would want to know about your blood sugar state, your fasting blood sugar. What is the level? Is it normal? Is it not? If you have pre-diabetes, which means you're on the borderline for diabetes, is it coming down? Is it getting better? If you do have diabetes, how is your hemoglobin A1C? You want to ask so that you know, and see if you have made any progress from the last time, and also so you can calculate the work ahead, how you're going to change this. Food is medicine. Make food your medicine. Okay, so all the foods that I recommend, that usually your medical provider will recommend, the vegetables, kale, spinach, these are your medicines. So you can still take your medicine, but move in such a fashion that you are not harming yourself and adding more medications that you might not even need if you make changes to your diet. So those are the some of the things on your blood work. Depending on, everybody's different, so depending on your medical history, your personal history, your doctor would be making decisions as to what other kinds of blood work you need. They are going to likely check on your kidney, your liver, all right, your thyroid levels. These things are all interconnected. If possible, have them check your vitamin D if possible. I know sometimes it will not be covered by the insurance, but if coded right, it might be covered. We all need vitamin D, but checking your level helps you know how much of it, how to intensify your intake. But ask about that. You need to know all these things. Yes, your doctor is responsible for helping you take care of your health, but remember also your doctor has so many other patients, but you have this one body, and this one body is also equally your responsibility that you have to advocate for by asking questions. So the last thing to know, or questions to ask when you go for that annual exam, are screenings. Depending on your age, you might be due for certain screenings. So screenings are done based on guidelines, recommended guidelines based on your age. So for instance, if you are age 40 or more, you might need a mammogram. So ask about that if you're a woman and you're due for that. Now also ask about certain other screenings. Again, depending on your lifestyle, people that smoke and have smoked cigarettes for a long time, they need a CAT scan of the chest to screen for lung cancer. And if you're of certain age, 45 and above, you need a colonoscopy. You've got to ask. If possible, don't take the easy way out of doing a stool test. Get a screening colonoscopy. When you get a colonoscopy, they go inside, look in at your colon, your large intestine, and if they find any problems, any polyps that are benign, they take them out right away. And then people with history of maybe family history of prostate cancer will need prostate screening, prostate cancer screening. There is blood work, there is a physical exam, all of that. So going in for your annual exam helps you touch on everything that is not currently a problem but could be a problem. Helps you screen for problems, help you know where you are metabolically in your health. Now this is very different from a sick visit where you go and you are sick, cold, or whatever else is going on. Is very different from that visit. So you want to not neglect this visit. Your insurance will usually pay for it once a year, and even if it's not paid for, if you go to a federally qualified healthcare center, you can get this done for a very reduced amount. Let me tell you, you can get even a mammogram done if you have no insurance. Let that not be something that deters you. You just have to find the right program. go to a federally qualified healthcare center and ask. They have programs, most places, that cover these essential, very, very essential screenings. When I mentioned mammogram before, I said age 40. Now, if you have a family history of breast cancer, like let's say your mom or your sister had breast cancer, then they bring down the age at which you might begin your screening. So you have to just make sure you know your family history. That's another thing most people don't. You have to ask. You have to ask your parent, your mom, your dad, what is their medical history, because it affects you, right? It affects you. Many things are passed on genetically. So, but if you don't know, then you're not even looking at it. If you tell your provider about your medical history, your family history, then they know what to suggest to help keep you safe. So these and other things are what I wanted to discuss today on the annual exam. I mean, annual exam is so huge. Then you're going to have so many questions that the provider is going to ask you when you go, but at least you know all these things. And the other part of it is also vaccinations. There are certain vaccinations due at certain times of the year and at certain ages. Depending on how old you are, you might be due for a shingles shot. You might be due for a pneumonia shot. You might be due for a lot of shots too. So these are why it's important to go in. Just go in. Wow, I love working out here. When I'm working out outside, I'm telling you, I can work out up to 30 minutes. But just because, and be careful when you're working out outside. Make sure the sun, make sure it's not so high already, like mid-afternoon. When I'm doing this outside, I try to do it around 8 o'clock or so in the morning, 8, 9, and then get back in. Otherwise, you are now exposing yourself to not just sunburn, but also more things that could cause skin cancer. Okay, and if you're going to walk outside, on me I do have my facial sunscreen. Put on your body sunscreen before you go out there to walk outside. Okay, my exercise today is almost done, and the takeaway from this video is that we have reviewed, I think, 5 of the metabolic markers, the things that tell us we are healthy, that we should look out for to get from our annual exam. And that is, in review, the cholesterol panel, which will include your triglycerides, 1, your HDL, 2, your LDL, 3, and then your fasting blood sugar, and then your waist circumference, which will tell you, how your metabolic health basically is. So all of those markers is what you should be expecting to get checked at your annual exam, as well as other important blood works, hormonal checks for your thyroid, your kidney, your liver checks, and other exams that you might be due for. We talked about some screenings that you might be due for. We talked about based on your health history, based on your age, and based on obviously your sex. All of that is important. And usually when I exercise, let me add here, in the beginning I stretch before I start. Before you see me on video, I'm already done with my stretching, and at the end I start to slow it down. That's where you see me having this fun dancing, slowing it down. The weight is off. I'm just slowing the body down, getting it ready to call it a day. And after I'm done, I usually stretch again off camera, so that you don't hurt yourself during these exercises. You do what your body can tolerate. That's what you do. And this is the end of this one. Thank you for a great workout. Come with me on the next one.